I'm a physiotherapist. I have a master's degree in rehabilitation sciences at McGill, and now I just started my PhD in epidemiology at McGill. And my main interest is working with digital health and public health, and how can I help improving the patient's access through technology, and how can we implement these technologies into the public health in a easy and good way to be experienced by health professionals and patients. I have the opportunity to use interactive games during my undergrad, so that part it was very useful in my professional experience. But I'd like to have had more opportunity to use other kinds of assistive technologies, especially with patients with neurological conditions. I think they are very, very useful. But also, as we have many different affections of different diseases, I believe that any kind of adaptation we can make, it's valid. So now I'm very interested in not really working with, but knowing about adaptive softwares for communication. That's the magic of technology. We can use our creativity to explore what we want to do, and I think we have a very good opportunity to use our creativity with the technology to improve our treatments and improve the way that the patient communicates. We can improve their functionality through technological adaptations, and I'm very happy that we have these opportunities now, and that it's been growing exponentially in the last years, because I think that's going to be very useful for the patients and also for the healthcare professionals. I believe that now costs are the most is the biggest challenge for the technology, but also we have to pay attention on how the patients are being adapted to this technology. We have to be careful in this adaptation process, because different patients have different affections, and then some of them have motion sickness, they have visual impairments, because it's not something that we can use this in the same way for all patients. We have to evaluate them in an individualized way. So that's another thing that I like to explore in my research and my clinical practice, this individualized assessment, and also the training of the professionals. I know sometimes it's harder to implement these technologies in the workflow, but I really believe it's worth it. We can improve the quality of the services. We can improve how many times the patients are living with that a health condition without having any treatment. So we can actually decrease the waiting time. If we give the right treatment at the right time, we can improve patients' functionalities, improve their daily living activities, improve the way they are circulating into the city spaces. We can improve consequentially their quality of life. So I know we have a lot of challenges, but we have, I cannot count how many benefits we can have, including technology, into the rehabilitation processes. What I think we should do as health professionals and as scientists, we should invest in this kind of studies, real life studies, about how can we really include this technology to be really used, not only understood and studied, but really used to be a useful tool for the patients and for the health professionals.